My name is Dr. Andrew Pisansky. I'm an interventional pain physician, and I work at Twin Cities Pain Clinic. I got into medicine for a couple of reasons. One reason was that I was fascinated from an intellectual standpoint with the science of medicine. Another was based on my experiences doing volunteer work across the country as part of a community service program. I met a lot of people that needed help, that had limited access to healthcare, and I wanted to do something in order to improve their lives. So I actually got started in public health, and I was doing a public health program when I decided that what I really wanted was to be a physician. And so I then applied to and started medical school a year later. I was initially attracted to pain management because I'm interested in big problems. As a person that had a background in public health, as well as an interest in treating patients, I learned that I could make a big difference in a large population of patients. There are over 20 million people in the United States that have high impact chronic pain that prevents them from doing the activities that they're interested in. As an interventional pain physician, I'm fortunate because I have access to special techniques and procedures that can help patients improve their functioning and also decrease their pain. I find that I get the joy of seeing patients, forming relationships with them, and then also giving them access to tools and treatments that they otherwise wouldn't have. To me, being a pain management provider is about two things. First off, it's about the patient, helping them decrease pain and also restoring function. The other thing is that being a pain management provider and an interventional pain physician in particular is a really exciting time, and it means innovation. We're at a point where there's an accelerated phase of discovery and innovation happening in pain management. Years ago, there really wasn't much, but now we have so many different therapies that we can offer patients. We have spinal cord stimulation, we have directed treatments for lumbar decompression and treatment of the back, and these are things that just weren't available before. And so, to me, again, it's improving function, but it's also the excitement of innovation. My patient care philosophy is around comprehensive planning for every patient. That care plan starts with diagnosis, from taking a careful history, physical examination, collecting imaging as necessary. And then after that, depending on the diagnosis and where we think the pain is originating from, coming up with a customized plan that takes care of the patient. That plan usually starts with physical therapy and functional restoration. It then can be built on with medications. It can also be built on with procedural management. And over time, we get to see that plan play out. And as the patient improves or doesn't improve, we get additional data points and we adjust our plan along the way. So my philosophy really includes going through these, working from the most conservative, the least invasive options, and then always letting the patient know that if that doesn't work, that we have something else and a next step to go to, and then continuing with them down that journey. Outside of work, I enjoy running. I'm a fairly decent runner for a tall person. Enjoy golfing, and I'm a fairly bad golfer, also probably because I'm a tall person. I enjoy learning the guitar, and I really enjoy spending time with my family, which includes my wife and my daughter and my dog.